Just a little bit of overview for today. We're going to be going through some introductions, the value in competing in this competition, how it works, a little bit of logistics in the timeline, and then go through a Q&A session. So I introduced myself. I'm joined with Natalie and Laura, two of our amazing advisors. If you guys want to introduce yourself quickly.
I'm Natalie. I'm the Student Engagement Coordinator at the Center for Health Interprofessional Programs, which is more commonly known as CHIP. It's the unit that supports CLARION.
And I'm Laura Damer-Hess. I work closely with Natalie and Edie and many of our other student leaders on all things CHIP, including the CLARION student organization.
So CLARION is a student-driven organization with the mission to develop a future healthcare workforce that creates innovative, cross-sectorial solutions for the most complex health issues through interprofessional leadership, teamwork, and communication. So the interprofessional leadership has been a big draw factor for me in participating on the CLARION board, and I'm sure you'll see throughout the competition that it is really one of our driving factors that differentiates us from other case competitions. And through our mission and the work we do, CLARION envisions a world in which healthcare and resources are de-siloed, so health professionals partner with diverse communities to create patient-centered care and health outcomes improvements both inside and outside of the clinical setting. A little bit of information on how the competition works. So it is an in-person event that is on Friday and Saturday, which we'll go over the dates in a minute, but I believe it is in mid-April. And there are 2 rounds, so a preliminary and then a final round on Saturday. Friday's more of kind of like fun network building day where we have some events. And then Saturday is the actual competition day. So the teams are made up of 3 to 4 people with at least 2 professions represented on each team. So you can't have a team of 3 med students, but you could have maybe 2 med students and an MHA student and a nursing student, or whoever you see fit. And then these must be full-time health professional students. So some problems addressed in previous years are major public health disparities and individual healthcare inadequacies that reduce patient health, maternal and infant mortality, opioid crisis, mental health, childhood obesity, rural healthcare, and then burnout and belonging in healthcare teams and organizations. So to participate in this event, you don't need to have any clinical background, but it's always great to have, the different professions and see what kind of things they can bring and what kind of perspectives, but it's not going to be solving like a case on how to solve this person's diagnosis or anything like that. And then how it works is we give the teams a case packet that has the case and some more information, and you have a few months to solve it. And then on the day of the case, you deliver your solutions or recommendations, and we ask that they are multifaceted and innovative, and then they address the major problem of the case and the root causes. How the judge evaluates the delivery is based on the style and the content of the presentations, and then the Q&A after, where they just ask you some questions, and then they ask the team the questions, and then the team will respond. And then we've had some really great student representation over the past years. So in 2024, we had 12 universities compete and 47 students within those universities, along with 15 health professional programs represented in the competitions. And we're hoping that this year we can get that number even higher. So for the past few years, these are the schools that have participated. So if your school is on here, welcome back. We hope you had a great experience last time, and that's why you're here. And if your school is not represented, welcome, and we're glad you're interested in the CLARION National Case Competition. So like I mentioned, the interprofessional collaboration is really a draw factor for this case competition. So here are those 15 professions that we have listed, that we have had people participate in the last few years. And then for the draw factor of why competing, again, interprofessionalism, you get the opportunity to solve complex public health and healthcare issues that they're always talked about. So it's really great to see some really innovative recommendations come out of these case competitions from bright-minded students. And then being able to problem solve in a realistic setting is really great. And then it's a lot of skill and competency development with being able to take a whole case, come up with recommendations, and then present on them and explain the why behind the recommendations. And then there is a cash prize for first, second, and third place teams. Now on to important dates. So registration opens October 1st, and the early bird deadline is November 16th. But if you can't get in by November 16th, the official registration deadline is January 16th. The case and guidebook is then released on January 18th to all teams, and then the national case competition is April 11th and 12th. So linked at the bottom of the screen is our website where you can find a little bit more information if you want. And then just some past testimonials. I think there's a lot of value added from participating in the case that we talked about a little bit earlier in the presentation. Some key learnings on how to actually solve healthcare issues with real world recommendations, and then time management. So this is, an extracurricular event where teams need to give time on top of school, which is definitely a great learning experience. And then you really get to develop a good relationship with your team and then with the other teams competing in the case competition in April. So now I'd like to open it up for any questions and we can answer that.
Of questions in the chat. So there's been some addressed a bit in the chat. There was one question about defining a full-time health professional student. And Laura put a good guideline in the chat that the idea is that a member on a team doesn't have a full-time leadership role within a healthcare organization, and they're pursuing a part-time degree on the side. Then there was a follow-up question about whether the competition is focused on professional / entry to practice students, or if nursing students who are practicing nurses seeking advanced degrees can participate. I'll just, Laura had answered, but we do often have people who are registered nurses compete in the competition. So that's not like a barrier to entry. And then there was one more question here. Do we have to know team members to participate in early registration? No, you don't have to know who your team members are when you register. Most teams don't actually know who their team members are. Most institutions don't know who their team members are until March. Just because institutions will do like local competitions sometimes to decide who's they're sending, or they'll do faculty nominations or an application process. So really during the registration process, you just give us a general idea of who you think might be on the team. You can say like occupational therapy, nursing, and social work, but you don't have to have the actual like names and emails or anything of the students who are going to be part of the team.
This is Lisa Langdale again. Can you remind us when the case will be released?
Yeah, so late January, it's always released. We have a date on the calendar this year for January 18th. It's always released on a Saturday, and we release that to all teams who are registered for both our local and the national competition on the same day.
We will soon, actually probably within the next week or two. We always release the case topic, the general case topic beforehand to any schools who are, to anyone really, schools who are registered and schools who are interested, as that sometimes is a way to recruit student participation if that's a topic area that they're really interested in. So keep an eye out for that. We're not ready quite yet. But everyone, again, as Natalie was saying about the case, everyone who's expressed interest in Clarion, including all of you, will get that information all at the same time.
And I'll just say too, as a member of the case writing team, they are very intentionally designed to address the problem on like a micro, a meso, and a macro level. So I'm obviously biased, but I think that it's a really neat way to address a problem and look at it from, different angles.
Yes.
In the chat here, yeah. Will there be an email push for when the general case topic is released? Yes, we will definitely send a message out to everybody who's on the national email list.
I know we have folks on the call that are already signed up for this year, folks that have been in for previous years, and probably some too who are have not participated yet from your college or university. So just acknowledging that and welcoming any questions from basic to more in detail. We are here for any of those.
Hi, it's Lisa again. And this may be on the website, and I just didn't look that far ahead, but is there a hotel that you will recommend for lodging and giving a discount for participants? Um,
Yes, there is. There's a hotel directly across the street from our main building that we have that we use for the.
Perfect. Okay, great.
Yes,
Thank you.
yeah, it's the Graduate Hotel in Minneapolis, and it is on the U of M campus, and we do have a room block reserved, so we can provide that information via email.
I'll also just add in another tidbit that you might be interested in. For those of you who've been involved in the last few years, you might know that Clarion, the student leaders and case writers and other community partners have been working together over the last few years to make the cases a closed loop, meaning that the case is co-written by a healthcare organization and that members of that healthcare organization are also part of the judging panel. So that student ideas are being presented directly to folks that may be able to use them and put them into practice. And I know that, again, that came from student leaders in our Clarion student organization really wanting to see the cases move from more hypothetical to more concrete and have their ideas go toward a potential impact on an organization. And so we'll tell you in that same email about the case topic, we can also tell you who the partner will be for this year. So, but in general, that concept is something that I know students really appreciate and is very cool to see, because not only does that mean the solutions and the ideas that students come up with could be used, but it also means that the feedback that students get, which is a really important part of the learning experience for them, is coming directly from someone who knows the challenges really well and therefore can be doubly appreciative and also doubly understanding of what might be missing and give that constructive feedback as well.
Speaking of feedback, this information is all in we release a guidebook to all registered teams on the day of case release as well. And the guidebook goes into more logistics in terms of like judging rubrics and, you know, things to consider for travel and all of that. But each team has 30 minutes allotted to their presentation. So 15 minutes is where you're actually presenting your solutions. 10 minutes of that is Q&A for the judges to follow up with you. And then there's 5 minutes of feedback for students afterwards, also built into that time.
Will you please put the timeline back up? That you had one with January, April.
There we go. So yeah, January 18th is when the case and guidebook will be released.
So April 11th through 12th, if we have winning students, that's when we would think about going.
So all student teams participate, all of the teams participate the 11th to 12th. So there are rounds in the competition, but all of those rounds happen on Saturday. And different from some other competitions where the actual event, how long you stay might depend on how you move forward in the competition. This Clarion case competition, everyone is a part of the entire event. So we have Friday, we have more community building and fun and educational events. And Saturday's the competition, which is capped off by a celebratory awards dinner for everyone.
We will provide some more info on timeline. I will say we usually start activities at like 1 p.m. on Friday, the 11th. So if you are able to fly in on the 11th and just get to the U of M campus before like 1 p.m., you won't miss any of the planned activities that we have. That being said, some teams do choose to fly in on the 10th and stay an additional night in the hotel just to, give themselves some pad time with travel as well. But usually if you can get a morning flight on Friday, the 11th, you should be okay to not miss anything.
In the past, how many judges have there been, or does that vary year to year? Is that a set number, or does it just depend now that the health organizations are participating?
We usually have 3 to 4 per room, and we usually have 3 rooms going in the first round and then 1 room in the final round. So around 15 judges total usually. Usually we have, like 12 in the morning, an additional 4 or so. I would say somewhere between 15 and 17 is the usual number of judges. There's another
That's
question.
helpful.
Yeah,
The,
sorry, did you follow up?
the students just like to know how many people they're presenting to. So 3 to 4
Yeah, usually 3 to 4.
is great. Okay, perfect. Thank you. I'm sorry.
No worries. Yeah, there is a chat here. How many faculty can attend with the student teams? And Laura put a response that says 1 is included with the registration fee, but if you'd like to have more, let us know. And then a follow-up question. How many total people are included in the conference registration? So 5 total, 1 faculty advisor and 4 students.
Another thing I'll highlight, just for those of you who may have been part of other case competitions, but have not yet been to Clarion, is Edie and the rest of the student board. One of the unique things about Clarion is that it is run by students. And so there is always a connection between the student leaders at the University of Minnesota and your student team. So they have a student leader on our campus to reach out to beforehand with questions, to meet them, and help them navigate their way around campus to they're not going to miss their presentation time or location, for example. They'll have a University of Minnesota student who will be with them through that, and then also be part of helping them reflect after the time. So it's just something that is unique. We really value that here, and I think it's something that that many people comment about being a valuable part of the experience, and kind of shapes the tone of the weekend, which is really focused on those students as emerging leaders in healthcare and supporting one another across professions.
Yeah, that's a good point, Laura. Last year was really cool getting to have the students participate and present, and then right after give some feedback on how they think it went, how the competition has been running in general, instead of, waiting a few days and forgetting some of the little points they have to make. And then we really value that feedback using and utilize it for the upcoming year. So I just think that's a really cool part of the case competition.
Another thing that we like to joke about when we do the national competition is that we're in Minnesota, right? So we have had students, we will have our fingers crossed, and it's only happened 2 years out of like 20 that there's usually not huge snowstorms in April, even though we are a cold weather state, but it has happened a couple times. And I think, as a lifelong Minnesotan, one of the most fun things is seeing those students from Texas and Florida. And we've had several students see their first time seeing snow at the Clarion case competition. So we really are we always have, like I said, 2 years. We usually have much better weather than that. But in whether we're sunny or snowing, we are excited to show off our place too. We're proud of it.
There was no snow last year. It was in the 50s, maybe. Pretty sunny.
Very nice.
We've had 70-degree days. April can be
April's,
anything.
it does whatever it wants to do.
We'll give you weather. I mean, everyone can look up the weather, but we still always send some recommendations. So
We do send a recommended packing list as well.
Well, yeah, like Natalie said, this isn't your last chance for questions. Feel free to reach out.
Yeah, we can wrap up early. Hopefully everybody has a good rest of their afternoon, evening, and hopefully we'll see you in April.
Yeah, we really appreciate your interest in Clarion and the University of Minnesota programming. So thank you all. Have a great weekend.